It's Friday, so that means infectious disease specialist Dr. Zain Chagla back on the show with us, joining us for his weekly update. Good morning, Zain.
Morning, Tim. How are you?
I'm doing awesome. Great to talk to you. And I want to start with boosters. And I saw something yesterday. It was from Dr. Michael Ryan from the World Health Organization. And when he was talking about boosters, he was saying that it's like handing out extra life jackets, but we're letting those others drown without a life jacket at all. How important are these boosters?
Yeah, so there are populations that definitely do need a third dose, right? And these are people where actually probably their first two doses probably didn't get them enough to have immunity. These are people with transplants. I think our long-term care sector we're going to start immunizing. And again, these make sense. They're high-risk people. Their immune systems aren't perfect, and so they need more protection from a more virulent variant. But when you start talking about healthy adults getting a third dose of vaccine, with data to suggest anything more than potentially a little bit more breakthrough infections, mild illness, but nothing to suggest more hospitalizations, more ICU stays, more deaths in these populations, when we see the vaccines are working really well at preventing people from getting sick, and even in Ontario we're seeing this, it's really hard to justify an approach that then uses boosters because, again, 1% of the developing world, particularly the low-income world, has received a dose of a COVID-19 vaccine. It's very important that that supply really goes to those places that we haven't been able to vaccinate appropriately, and it's all been tied to supply. And really, our use of vaccines in the high-income world has really limited their use in the low-income world, and we can't really let this happen for much longer.
That leads into daily numbers. Are we too concerned about these daily numbers? Like, we're seeing upticks, right? And then you saw that 500 mark. You're just like, oh, 500. Are we too concerned about these numbers? Do they matter as much right now?
Yeah, I think Ontario is now reporting unvaccinated cases, right?
Yeah.
And there was always this link between cases, hospitalizations, ICUs, and deaths. That link still exists in the unvaccinated world, especially those over the age of 18, where as we get more adult cases, it's going to lead to more adult hospitalizations. It's going to lead to more deaths and more ICU stays and healthcare capacity, which is probably the biggest metric that we have moving forward. So I think Ontario's responsibly tried to put it out there. But it is starting to get concerning in the sense that, we're seeing 200 to 300 cases a day in unvaccinated individuals, and probably more than 2/3 of them are in the adult population, meaning that they have a risk of ending up in hospital and a risk of ending up on a ventilator and a risk of dying from this. So, the messaging here is unvaccinated cases are going to lead to health systems strain, and the solution is turning them into vaccinated cases, and again, not leading to health system strain.
Do you have many dealings with people that are not vaccinated? Like, do you have any conversation with them? Like, their points, can you agree with any of their points that they're bringing to you?
Look, I think we probably have the impression of folks out there that are fairly strong in their opinions around vaccines, that they're experimental, that use a bit of misinformation. And that opinion is probably the more vocal opinion out there. The conversations I have every day with patients, it's minor things. It's, is my medical condition safe to have this vaccine? Well, for the vast majority of patients, it is. It's, I don't know where to get the vaccine. And even though we have access that's open and available, they don't have family or friends that are savvy that can, tell them that most of these clinics are walk-in. So, I think there are still barriers in these conversations with patients. There's easy wins with these patients. And again, some of that misinformation that they have can easily be dispelled by just having thoughtful, honest, non-judgmental conversations, and even using, my own experience as a person, right? Telling people, I have my family, my friends, my parents, my spouse all vaccinated. I had no concerns getting them vaccinated. I think instill some trust in people that you're following the same medicine that they are, and again, they're much more likely to follow as long as there's that trust along with their provider.
I got to 3 of the 10 questions that I have for you. I wish we had more time. Listen, I don't get to talk to you very much, but I'm always tuning in when you're on. So I appreciate you coming on every week, and I appreciate all that you're doing and educating everybody out there. So have a great weekend.
Amazing. Thanks, Tim.
Dr. Zane Chagla with his weekly update.